Xolgensma. This drug is worth at around $2.1 million. It is used in the treatment of spinal muscular atrophy, SMA. This genetic condition causes deterioration in motor neurons that controls muscles, resulting with the weakening and wasting of muscle, mostly developing before birth and during childhood. A child with SMA may have a normal life expectancy, however they will suffer from many medical complications, from breathing difficulties to uncoordinated walking and to being completely paralyzed. There are 4 types of SMA that affect people. Xolgensma addresses all 4 types of SMA because it is a gene replacement therapy, replacing the defective gene that causes the condition. It is delivered by a medical officer through an infusion into a vein and only requires 1 dose. ZokinV. This drug costs a staggering $1 million a year. It is the first treatment approved for Hutchinson-Gilford progeria syndrome, a progressive genetic disorder that causes children to age rapidly. The genetic mutation occurs randomly and isn't inherited. ZokinV, an orphan drug meaning the disease it treats is so uncommon that pharmaceutical companies typically won't develop it unless they receive government funding. The life expectancy for this condition is usually around 15 years. However, Tiffany Wedikind of Columbia, Ohio, is believed to be the oldest survivor of progeria at 41 years old as of 2020. Dancelia. This drug costs $977,664 and is used to treat pediatric and adult patients with neuroblastoma in the bone or bone marrow, also known as bone cancer. This drug costs $20,368 per vial, and patients uses around 48 vials per year. Without treatment, the life expectancy is around 5 years. Some symptoms include back pain, dark circles similar to bruises around the eyes, bone pain, eyeballs that seem to protrude from the sockets, and many more. With its current price, this drug could easily put you out of pocket, and leaving you with no money at no time. Myelept. Myelept is a drug that can be dispensed directly from the pharmacy. It is used to treat leptin deficiency in patients with generalized lipodystrophy, a condition of abnormal fat distribution in the body that causes excessive accumulation of fat, causing you to gain rapid weight. Unfortunately, Myelept is the only treatment available to control this rare condition, and there are no other cost-saving alternatives. Without treatment, in most cases leads to premature death, cutting the patient's lifespan by 30 or more years. Luxturner. At $850,000 a year, Luxturner is the 5th most expensive drug on the list. Luxturner is a gene therapy that treats an inherited form of retinal dystrophy, a condition that causes vision loss, and even complete blindness. The drug can only be administered by the doctor, and cannot be purchased at the pharmacy. Folatein. Folatein is approved to treat peripheral T-cell lymphoma, a rare blood cancer that can cause death. T-cell lymphoma is a rare type of cancer that begins in white blood cells called T-cells. These cells normally help your body's germ-fighting immune system. If not treated, life expectancy for aggressive lymphoma is around 5 years. A healthcare professional must administer Folatein, and patients are typically given 45 vials of the drug annually. The list price for a vial is $5,880, bringing the total annual cost to $793,870. Brinura. Brinura is a first-in-class medication, a drug that uses a new and unique mechanism of action for treating a medical condition that treats a specific form of Batten disease, called late infantile neuronal ceroid lipofuscinosis type 2. A disease that affects the nervous system. Some of the common symptoms include recurrent seizures, muscle twitches and vision loss in children, not to mention losing ability to sit, stand, walk and talk. Juvenile Batten disease occurs in children between ages 5 and 10. These patients usually live until their late teens or early 20s. The price tag of Brinura is $28,090 for 300 milligrams. The recommended dosage is 300 milligrams every 2 weeks, meaning that over the course of a year, costs adds up to an incredible $730,340. Blisto. The 8th most expensive drug has an annual list price of $712,672. Manufactured by Amgen, Blisto is used to treat a rare form of acute lymphoblastic leukemia, a cancer of the blood and bone marrow, preventing the proper functioning of germ-fighting white cells. Some symptoms include unusual and frequent bleeding, such as bleeding gums or nosebleeds, constant bone and joint pains, easily bruised skin and many more. The life expectancy for this disease without treatment is at around 5 years. This drug is given in cycles. Patients need different amounts of medication during each phase, roughly at around 168 vials per year. Ravichi. This drug is used to treat urea cycle disorders, affects close to 1 in 30,000 newborns. This condition causes a buildup of ammonia in the bloodstream. If left untreated, it can lead to confusion, coma and even death within a very short period of time. Ravichi is dispensed at a pharmacy and doesn't require administration from a healthcare practitioner. Patients are typically given 132 bottles annually, at $5,273 for one bottle. The total price skyrockets to a staggering $696,036, well over the affordable price range. Solaris. Priced at $678,392 per year, Solaris is used to treat paroxysmal nocturnal and atypical hemolytic uremic syndrome, blood disorders that result in the destruction of red blood cells and impaired bone marrow function where the blood cells are produced. Some common symptoms include significant fatigue or weakness, shortness of breath, uncontrollable bleeding and many more. The life expectancy if not treated is around 10 years. The dosing regimen for Solaris can differ depending on the age of the patient, but most patients need a maintenance dose of 1,200 milligrams every 2 weeks, which only a healthcare provider can administer.